Good afternoon, everybody. We're just going to give everybody a few minutes to join the Zoom, and then we'll get started. Okay, it looks like that number's settling off. So good afternoon. I'm Alexis Rothenberg. I'm Executive Director of Alumni Relations here at Mercy University. Welcome to our Medicare 101 webinar. We're thrilled to have partnered with Chapter Medicare to help provide our staff, faculty, and alumni with a Medicare resource. Whether you are new to Medicare, have questions, the experts here today will be able to help you out. A little bit about our speaker this afternoon is Thomas Pruitt. He is a lead advisor at Chapter and an expert on Medicare. He joined Chapter about a year ago and has helped hundreds of Chapter members sign up for Medicare by breaking it into simple, bite-sized pieces. He now trains and manages Chapter's team of licensed Medicare advisors. And we're thrilled to have Thomas and the whole Chapter team with us here this afternoon. As you'll see, and we've got the Q&A and chat function open. So feel free to ask any questions that come up. We'll get to them at the end of the program. The experts will be monitoring it and we'll get back to you. Certainly, if it's a more personal question, they'll help arrange a personal one-on-one consultation with a Chapter consultant to help get your questions all answered. And Thomas, I will kick it over to you.
Alrighty, perfect. So let's go ahead and get started here. I think Michael's going to share a screen for us here today, so that way we have some visual elements for you guys. So give it just a moment here before we get started. And thank you so much, Alexis. It's certainly a pleasure to be here this afternoon. What we're going to go through today, let's see here. And
I think we're going to need to enable screen sharing. Canwin, if I think you're the host of the webinar.
Yep, I enabled it.
Okay, beautiful.
Alrighty, perfect. So we'll go ahead and jump all the way to slide 5 on the deck here, Michael, and then we'll go ahead and jump in. So I want to give you guys, in case you want to be able to take some notes today, I want to first give you the agenda of what we are going to go through. Now, of course, at any point in time, we do have a couple of Medicare advisors in the chat. We have Jill and Tristan with us today. So please do take a moment to throw a question in the chat if you do have one. They're available to provide some good expertise there. With that being said, what we're going to cover in this webinar today is going to be 3 things: the key parts to Medicare, 3 bite-sized decisions on how we're going to take action, and then, of course, at the end there, I'll share with you what it looks like to actually take action. On the next screen, what you're going to see is we first like to take a look at Medicare as far as key components, like a 3-legged stool. The way that this works for us is we're going to have hospital, outpatient, and prescription drugs. And you can't have a stool without 3 legs, so we have to make sure we have all 3 parts. Now, 2 of the legs of this stool are provided by the federal government directly. The time that you turn 65 or the time that you lose your employer coverage. More on that here in just a moment. But on the next screen, I wanted to give you guys a foundation of what those key components are. The first one is going to be your Medicare Part A, which is your hospital insurance. Most individuals are going to refer to this as inpatient care. What this includes are items like hospital, mental health, skilled nursing, home health care, and hospice care. As long as you or your spouse work the required 40 quarters in the United States, typically this is going to be fully prepaid, so you will have 0 premium attached to this Part A hospital. With that being said, the way that it works in 2023 is you pay 0 premium, but if you were to go to the hospital, there's a $1,600 deductible that would be charged to you the moment that you're admitted. That $1,600 deductible is going to cover you for the first 60 days that you are in the hospital. If you do go beyond 60 days, there are additional copays, but we won't get into the weeds here because 99% of clients are not going to stay more than 60 days in a hospital. Something interesting about that deductible, though, it does reset once you go more than 60 days between hospital visits. So it is very possible that you could end up having that deductible more than once in a given year. With that being said, the vast majority of what you're going to experience on Medicare falls under what's called Medicare Part B, which is considered your medical insurance or your outpatient care. Now, for 2023, the premium of Medicare Part B has been $164.90 per month. That is going to go up to about $174 and change next year. So do keep that in mind as you're kind of putting your budget together. This is the first premium that you need to be aware of. So with that being said, the way that the coverage works, right now it's $164.90 per month. Once you pay that premium, Medicare Part B functions with a $226 one-time annual deductible. Once you've paid the first $226 of medical services for the year, Part B is going to kick in and cover 80%, leaving you with a 20% coinsurance. Now, what does it cover under Part B? Typically, that's going to be your doctor's visits, lab work, x-rays, MRIs, medical equipment, surgeries, among many, many other things. Just keep in mind that it's pretty much essentially everything outside the hospital. So quite a large umbrella that's included in that 80% coverage. Now, once you have been approved for Medicare, on the next screen, what you're going to see is what a typical Medicare health insurance card does look like. A couple key elements here. It is a red, white, and blue card. So when you talk to one of our advisors here, we will refer to that as your red, white, and blue card. You'll see your name printed on this screen, as well as your unique Medicare ID. About 5 years ago, it used to show your Social Security number. Social Security did actually get smart in this time and decided to issue a unique number, so it does take a little bit of the stealing of information away. You will know if you've enrolled in Part A and Part B correctly if it is printed on your card. If you do not have a card that shows both Part A and Part B, more than likely there's some sort of issue with the enrollment of your Medicare. So that's kind of the first safety check that you have for yourself. Now, there are some key points that Medicare does not cover. The first one that you're going to notice is that there's no financial limit, which is also known as no maximum out of pocket. Going back to that thought just a moment ago of Medicare covering 80% on Part B, leaving you with a 20% coinsurance, there is no cap to that 20% coinsurance. So if you go get a knee surgery done and it costs $30,000, you can expect to pay $6,000 for that knee surgery. Another element that's not included with Medicare is what's considered long-term care. Part A is going to cover you for the first 100 days that you spend in a skilled nursing facility. Once you've exhausted that time frame, you are now into what's considered long-term care, which is not covered by Medicare. So you will need to pick up a long-term care insurance policy or prepare to pay fully out of pocket for something like that. So do keep that in mind. Now, of course, if you have any questions about the foundational elements of Medicare, please throw that question in the Q&A section on here in the Zoom. Jill and Tristan will be happy to take a deeper dive with you guys. And of course, we'll take some questions along the way as well. On the next screen, I do want to break out what the 3 decision steps are for your Medicare. As you can see here, it's going to be one of 3 things. 1, sign up for original Medicare. Step 2, how will you cover the other 20% that Medicare does not cover? And then finally, step 3 is how do we take action? So very key steps here. On the next screen, we're going to cover what's considered the first step, which is how do you sign up for original Medicare? Now, for the vast majority of people, that's going to happen on the month that you turn 65. So on the next screen, you're going to see a chart here of how that does look for you. So when can you sign up for Medicare is the key question you have to ask yourself. So you see here 65th birth month, but you see a start and an end date. What you have with the month that you turn 65 around it is what's called a 7-month initial enrollment period window. That's going to start the 3 months before the month of your 65th birthday. And that's going to end the 3 months after the month of your 65th birthday. So an example that we commonly use is if your birthday is December 23rd, the earliest that you could sign up for Medicare would be September 1st, and the end of your initial enrollment period would be the end of March. So if, you can go ahead and click through a couple of the animations here. Perfect. So as you see there, total of a 7-month initial enrollment period window. And then along the right-hand side, as he kind of clicks through the slides here, you'll see a couple of those bullet points that I went over for you guys. Now, a very common question that we get is what happens if I would like to continue to work beyond the age of 65. So the exception here is if you work for an employer that has over 20 employees, you can expect to delay Medicare at that time. Now, when you do retire one day, you will have what's called a special enrollment period window, which begins the month that you lose health coverage and goes for an entirety of 8 months. I certainly don't encourage anybody to go more than 60 days without any coverage at all, because that raises some other risk factors. So my recommendation to you guys is to get the coverage as soon as possible, so that way you don't have any kind of gap in coverage. Now that stands for just your Part B. Most people that work beyond the age of 65 will take their Medicare Part A and delay Part B. The exception to that is you should not start Part A either if you plan to actively contribute to what's known as a health savings account, or HSA for short. Now, that was quite a bit of information. Of course, throw those questions in the chat if I wasn't clear in any areas. But one thing to really drive home is if your employer has over 20 employees, you do not need to take Medicare. And by delaying Medicare, you will not incur any kind of penalties. Now, on the other end of that spectrum is if you work for an employer that has fewer than 20 employees, then you will need to start Medicare in order to avoid any kind of penalties with Medicare. So fewer than 20 employees, that you can keep the coverage if you want to, but Medicare has to be primary at that point. So the rule of thumb, if you're taking notes, is that magic number is 20. Does the employer coverage have more or less than 20 employees? If more, you can delay Medicare. If less, you should be starting Medicare. So hopefully that made some pretty good sense for you guys. Now on the next screen is going to add an additional wrinkle to Medicare. This one's a big one for those that have some high income earning situations. This is what's called IRMA. The way it spells out is income related monthly adjustment amount. What this is essentially doing is adding income into the equation for your Part B and Part D premiums. Now for 2024, if you report taxes individually, they're going to look 2 years back in 2022 to see if you made more or less than $103,000. If you file taxes jointly, they're going to be looking back at 2022 to see if you made more or less than $206,000. What they're looking at there is usually line 11 on your tax statement, and it's the modified adjusted gross income. If for any reason that you're reporting over that amount 2 years prior, on the right-hand side, you see that it's a progressive system, just like the tax system, of how much more you will be paying for your Part B and Part D premiums. So with that being said, in the event that 2022 tax returns are not representative of what you project to make in 2024, there are 8 appealable events that you could file with Social Security to have the income-related monthly adjustment amount removed from your profile. This is a great opportunity that if you have time to sit down with a Medicare advisor, like somebody here at Chapter, this is a great opportunity to work through this and ensure that you're getting the most effective plan for your Medicare, but also not paying more to Social Security than you need to. So, and also please reach out to questions in the Q&A chat on this one, and also the Mercy University at askchapter.com if you would like to ask questions later. Now, on the second step of this 3 decision step process is how will you cover the 20% that Medicare does not cover? A little bit more on that as far as that 20% is you see on the left-hand side as it comes up on your screen that 20% of most medical costs are going to be your responsibility if you just have Part A and Part B. In addition to that, original Medicare does not cover most prescription drugs, which is going to be anything you pick up at the pharmacy. They also do not cover dental, they do not cover hearing, and they do not cover your routine vision appointments. That would be going to see an optometrist to get your eyes checked for glasses. So there's quite a bit of an area of gap that you have by just having original Medicare. So ultimately, what 99.9% of individuals do is they decide one of 2 different directions for their Medicare. So on the next screen, what you're going to see is there's 2 different comprehensive coverage options that are available to each and every American that's on Medicare. Option 1 is going to be to keep original Medicare and add what's known as a Medicare supplement plan or a Medigap plan. We refer to these as a pay upfront style insurance coverage because it acts secondary to Medicare and pays your copays and coinsurances on your behalf. Now, what's great about keeping Medicare as primary in this situation is you can see any doctor, hospital, or facility throughout the United States that accepts Medicare, which is roughly 96%. So if you value the flexibility of going anywhere that you want to, including specialty hospitals, option one is going to be a fantastic route for you. In addition, if you plan on living in multiple places throughout the year, or maybe you just travel around the country, option one would also give you that control to be able to know that you can go where you would like to, and the peace of mind to know that you have coverage the same throughout all 50 states. Now, in addition to picking up a supplement plan in option one, you'll also need to pick up what's known as a standalone Part D prescription drug plan. In addition to that, you would also need to pick up a dental insurance plan if you wish to have additional standalone dental coverage. So more of an a la carte solution, but certainly the most comprehensive solution that's available with your Medicare. Now, on the other side of the spectrum is what's considered option two, which is to completely replace original Medicare. This is referred to as the Part C that you may be familiar with, Medicare Advantage, also known as the all-in-one plan. This is what you largely will see advertised in your mailbox, billboards, shopping centers, as well as the TVs where you might see Joe Namath make an appearance about this time of year. And no, he's not talking about football either. With that being said, Medicare Advantage is a pay-as-you-go structure of insurance. Since it replaces original Medicare, it does become primary insurance, so you would be subject to the network that this Medicare Advantage carrier would place you into. So that's where the HMO or the PPO situation may come in. It does combine your A and B along with your Medicare Part D prescription drug coverage, and it usually includes additional benefits for things like dental, vision, and hearing. And also keep in mind that since this is a managed care system, that these are known to be very regionalized. So if you go outside of your regional area, typically you're down to emergency style coverage only. So if you do have plans to live in multiple states throughout the year, or if you do a lot of traveling, this may not be a solid option for you. And in addition to that, if you do value to have a little bit more control over your medical decisions, this may not be a very good solution for you as well. So just keep that in mind as you're deciding between option one and option two. Another question that we get a lot on the screen here you see in front of you is on Part D prescription drug coverage. We have a lot of individuals that when they turn 65 are not actively taking any medications, or maybe they're taking very inexpensive or very few medications. The question we get asked is, do we need to have prescription drug coverage? The short answer is absolutely, because you want to avoid any kind of lifetime penalty. The penalty for not having prescription drug coverage is 1% of the national average premium for every month that you could have had coverage. And that can add up very quickly, and it is a lifetime penalty. You can pick up a standalone prescription drug plan for very, very few dollars a month, if any. So 2 ways of achieving it is either pick up a standalone Part D plan or to have it built into your Medicare Advantage plan. Either way you go, that's going to ensure that you're avoiding any kind of penalties. Now, if you're wondering what the most comprehensive coverage available on the market today is, I did tease it a little bit a couple of slides ago with the Medicare supplement, but to drill down a little bit further, on the next screen, you'll see what's considered to be the most comprehensive supplement plan on the market today, which is referred to in most states as a Plan G. This is going to provide you with no network restrictions, no referrals required for specialist visits, no additional bills or copays. This works nationwide, and you even have 80% international coverage. To give you a little bit more depth as far as how this coverage works, a supplement Plan G will cover all of your costs of Medicare Part A, from deductibles, copays, and coinsurances. It's going to cover all of your copays and coinsurances of Part B, leaving you only responsible for the one-time annual Part B deductible, which this year is $226. So once you pay the first $226 in medical services for the year, you can expect zero out of pocket for any Part A or Part B related service. Now, a question that we get asked a lot around Medicare supplements is, if I have a pre-existing condition, can I be denied for a Medicare supplement plan? Once you have been on Medicare for 6 months, which is, you look at your Part B date that's on your red, white, and blue card. Once you've been on Medicare for 6 months, the answer to this question would be yes in 46 states. If you're wondering what the other 4 states are, New York, Maine, Massachusetts, and Connecticut are always considered open enrollment and would not be subject to pre-existing conditions. In every other state, you would need to go through medical underwriting in order to be approved for a Medicare supplement plan. So please keep that in mind as you're trying to make your decision on which route that you would rather go. Now, on the next screen, we're going to go over the final step, which is how does one take action? If you sit down with an advisor here at Chapter who are very skilled at what they do, they're going to break down the consultation into what's considered the 3 Ps. The first P that they're going to look at is what's considered the providers. What doctors and networks are you most interested in having inside of your program? Once we've established that bucket, we're going to go into the second P, which is your prescriptions. So many plans are going to be dictated by the prescriptions that you take, and even so, by the pharmacy that you go to. So it's very important in the meeting to have your prescriptions and preferred pharmacy there. And then the third P that we look at is going to be your priorities. What lifestyle choices are going to be important to you? Do you live in Chicago half the year and Florida half the year? Do you really like control over being able to see a specialist without a referral or getting second opinions, or maybe just as simple as going throughout the country? There's going to be specific questions that our advisor are going to ask to see what that priority is for you. And keep in mind, too, that what your neighbor may have down the street as their solution may not be the right one for you based on how you answer these questions. Now, once you had made your decision on what you would like to do for your Medicare, the question we get asked is, should you adjust or reconfirm coverage every year? The very short answer to that is absolutely. Premiums, costs, benefits, physician networks, they're going to change every single year. Even if you have a Medicare supplement plan, you at least want to review your Part D prescription drug plan every year, because there's some monumental shifts that are going to be happening next year and the year after. So at the very least, reconfirm that coverage. And of course, if you're in a Medicare Advantage plan, what may have worked in 2023 may not work in 2024. So you want to ensure that you keep all of your doctors, and sitting down with a professional advisor to review this is certainly very key. And of course, here at Chapter, we're the only company that I know of that can see every single plan that's available inside your zip code. Now, that was just a quick overview of what we're capable of doing within the Medicare system as far as what decisions that you can make. I certainly do want to let you know that I appreciate your time that y'all spent with us here today. I did want to leave y'all with a couple of options here. There is a book written by one of the founders of Chapter here, Mr. Ari Parker, that goes even deeper into the discussion that we had today. The book's called It's Not That Complicated, which is the 3 Medicare decisions to protect your health and money. Simply scan that code you see on the screen here to claim your free copy, and we'll get that sent right to your doorstep. It's a fantastic book, very easy to read, and gives you a great foundation for your Medicare. In addition to that, if you want to have more of a one-on-one consultation, which this time of year is the right time to do that, simply scan the link on the right-hand side of this screen to schedule a free Medicare consultation with one of our experts here at Chapter. I do want to thank you again. If you have any questions at all, we'll leave this screen up here for just a moment so that way everybody can kind of scan. In addition to that, if there's any questions that haven't been answered in the chat, or if you want to bring some up to me, I can certainly answer those as well. Thank you, guys. And I'll toss it back to you, Miss Alexis.
Thank you so much. We really appreciate this. If you have any questions still, we can put them in chat. Did any of the questions that come in, are they worth bringing forward to the group? I think Tristan and Jill who are monitoring that.
I'm seeing one in the chat that is, but that doesn't make Medicare my primary insurance, does it?
Let's see. That might be a continuation of another question. Yeah, I'll kind of touch on a couple of the questions that I've seen be answered in the chat, so that way, in case anybody else is wondering. So if you are contributing to an HSA account, you should not sign up for Part A at all. The answer to that question is yes. You should not sign up for Part A, because if you do, your contributions moving forward would be considered taxable along with an 18% penalty. So definitely avoid Part A if you're contributing to an HSA. Another question I see here is if your company's 20 employees and above, it's okay to avoid a penalty. So you do not have to worry about a penalty as long as you're maintaining employer coverage that has more than 20 employees. Let's see here. Oh, another good question. If my spouse turns 65 before I do, but is still covered by my insurance, she should or should not apply for Medicare. As long as that employer coverage that you have covered her with has more than 20 employees, she can delay Medicare as well. Okay. And to clarify, should you enroll in Medicare Part A if you're still covered by a work plan with more than 20 employees? Only if you are contributing to an HSA. If you're not contributing to an HSA, I find it to be advantageous to go ahead and establish your Medicare Part A when you do turn 65, to go ahead and get that Medicare ID. So that way, when you add the other parts like your Part B or supplement or Medicare Advantage down the road, it's a lot less cumbersome of a process. Let's see. What happens if you did not delay Part B and are also paying for health insurance? If that health insurance is with an employer that has over 20 employees, you could submit a Part B termination letter to Social Security. I don't remember the number off my head. I could certainly find it. And you could stop your Part B until the time that you do lose your health insurance down the road. Again, must be over 20 employees there. And what if you're on Social Security disability and getting Medicare through that? Usually, when you're on Social Security disability under the age of 65, in most states, you will be restricted to a Medicare Advantage only solution. There are a few states that would allow you to pick up a supplement if that's what you're looking for, but they are oftentimes extremely expensive to those on Medicare under the age of 65. And I believe that's a few there. Let me go back over here. If you're enrolled in Medicare and don't need to change anything, do you need to do anything else to continue? As long as your plan has not sent you a letter stating that it's ending, there would be no action needed on your part to continue the coverage that you do have. So hopefully that answers that question. And how much approximately is the premium for the supplement? It'll kind of depend on a few things. Date of birth, what state do you live in, and whether or not you're male or female, and whether or not you smoke tobacco. Generally speaking, we can see premiums as low as $100 per month for that Plan G, and they can go as high as about $400 a month for a Plan G. It's really going to depend on those 4 factors.
Well, thank you so much. These were wonderful questions, and thank you so much for your thoughtful answers. We'll be sharing out a copy of the presentation and a copy of the recording in the coming days. So we'll definitely, get that information to anyone who's interested. And certainly Chapter is available for one-on-one consultations. If you have general questions, we'll put all of that information in the follow-up email. And I think there's one last question before we kind of sign off. Do you have to apply for Medicaid until you reach 65 if you are 62?
Really depends on your income situation. So Medicaid is a low income state program. More than likely, if you do not qualify for that, you'll want to at least pick up insurance through the healthcare.gov marketplace.
Wonderful. Thank you so much, Thomas and the Chapter team. We greatly appreciate your time. I'm sure this will not be the last time we hear from you, and we look forward to our continued partnership.
Thank you all so much. It was great to see everyone.
Thank you so much.